Right. All right. The Senate Finance Committee is now in session. The sponsor of the bill that's listed first was here, but is going out, so let's start with Senator Klossmeyer, 707.
Okay. So Senate Bill 707 is a bill that relates to health insurance and provider panels and the circumstance when somebody needs to go out of network to get a healthcare service. And so the House has adopted some amendments, which in this the amendments you have before you reflect what the House adopted. So there's been a lot of back and forth with with some of the providers, the behavioral health community in particular. And so we'll just go through the bill. So this is the part of the law that requires a carrier to allow someone to go out of network if they need a specialist and they're unable to get care from somebody who's within the network, who's in the provider panel. With reasonable access, without unreasonable delay or travel. So what the bill does is it requires each carrier to inform members of the procedure to request a referral under the law. So they've got to inform members of this ability to request a referral. And then on page 6 of 7 of the reprint, this is working to address the issue of consumers getting balance billed for services that they obtain from someone who's out of network, and so what the agreement is to require a carrier to ensure that when services received out of network for mental health or substance use disorders when these services are provided out of network, the carrier, under this part of the law, the carrier must ensure that these services for mental health and substance use disorders are provided at no greater cost to the covered individual than if the covered benefit were provided by a provider on the carrier's provider panel. So I think this is in essence a hold harmless provision, and so it will be up to the carrier when making this referral to work this out with the provider to make sure that the consumer is held harmless when they obtain services out of network. Some specific provisions have been struck in substitution for this provision I just described. And then on the last page of the bill, there's a reporting requirement on the health occupations boards, I guess, to provide a progress report with regard to their efforts to informing mental health and substance use providers about the about the ability to and an opportunity to participate in carrier provider panels. I think that this is in response to some of the feedback from carriers where they said they would like to have people in their networks, but providers are not. Sometimes there's insufficient outreach to get them in their provider panels. So the last thing I would note is that that there's a sunset placed on the bill, that it's in effect for 3 years. So I think that the idea is that there's an opportunity for seeing how the requirements of the bill will work. And if this process isn't working, then the legislature can come back and, implement a different approach to ensure that that patients, when they go out of network, are being held harmless. So I think that this is a product of some back and forth.
Okay. All right, we've got a motion and a second. Is there any discussion on the motion? If not, all in favor, raise your hand. Okay, that's unanimous. Thank you.
We can jump up to Senate Bill 661. This was a bill that was brought to the committee by some of the advocates on behalf of the pharmacists, and the bill is introduced aimed to include pharmacists in a number of provisions and statutes that are applicable to healthcare providers. And so the House has amended the bill to narrow its scope a bit, and I can walk through the reprint and explain what the amendments are. So originally, the bill would have included pharmacists under the Healthcare Malpractice Claims Act and its protections for healthcare providers. You know, there were some objections that came from the Association for Justice about that. Those provisions have come out. A provision that remains is one that includes pharmacists under provisions of law that prohibit the destruction of medical records for a specified period of time. So that provision is preserved in the bill. Other provisions that were struck were ones that related to pharmacists and the provision of HIV testing. And then what was added was also struck were some provisions that related to required reimbursement of services provided by pharmacists, required reimbursement by carriers for services provided by pharmacists. And instead, there's some uncodified language that would require the Insurance Administration to establish a work group with representatives of pharmacists, carriers, MCOs, and other stakeholders to identify options and requirements necessary for the reimbursement of pharmacists who provide medical services within their scope of practice and work setting. And then there's a report of findings and recommendations that would be due in December.
Okay. Are they? Okay. All right, it's been moved and seconded. Any discussion on the motion? If you're not all in favor, please raise your hand. Okay, that's unanimous. Thank you.
And there's one additional bill that we couldn't get in the voting list in time for it to be printed, but this is Senate Bill 632, and this is the bill that would require the exchange to establish a small business and nonprofit health insurance subsidies program. We had a work group on this, and after some discussion, Senator Hester is offering an amendment that would strike the bill and require the exchange to convene a work group to study and make recommendations relating to the establishment of this program to provide subsidies to small business and nonprofit employers and their employees for the purchase of health benefit plans. So provisions establish what the members, who the members would be, must be, who the work group will include, and some of the findings and recommendations that they're going to look at would relate to coverage needs of small employers, nonprofits, and their employees, objectives and target metrics of the program, the optimal scope and design features of the program, which are listed here, the cost to administer it, including the cost to provide subsidies and operational costs, and the sources and levels of funding needed to support the program. A report would be due by October, and there is some intent language added. It's just intent language, but it's intent language that says that beginning in fiscal 2024 and each fiscal year thereafter, the governor would include in the budget an appropriation of funding to establish and operate this subsidies program with the design as recommended by the work group.
Okay, Senator Feldman.
Yeah, so just a little background. So I chaired a work group on this bill. Look, the chambers of commerce in our state and business community love this idea. You know, I mean, for years, those folks came down with the idea of association health plans, but that had impacts on our small group that really was problematic. Rick Weldon, who many of you know, sat here on the work group last week. So I think this is the way to go right now because there are some moving parts. But fundamentally, the idea that we would give subsidies to working with the exchange, who likes the idea too, 37%, only 37% of our small businesses offer health insurance for their employees. It's 95% for the big companies. So we talk about all these creative things we do in Maryland and go from 12% uninsured down to 6 and 5. This is a big piece, missing piece that we can again, be pretty innovative. And as I say, for the business community really, really likes this idea better than it doesn't have impacts like those plans. So this is potentially a really good possibility for the next session. Because it's pretty complicated. It has to do with, the health benefit exchange has one idea on the model. You have folks off the exchange, the impacts on the small market, and the amount of money. Candidly, when this first came in, the thought was this is going to be paid entirely with federal money. Well, that federal money pot was not ultimately there, so now then it was. So for all those reasons, I think that it got to be a little too much for this at this end. But I think this is a great concept.
So now we have the work group.
What's that? Well, so the bill, originally, it was at 15, and then we had a consensus that the work group was smaller. You could bring it down to, because the real sweet spot actually is like under 10. And so there seemed to be some consensus around 10 or under, but that's all, so.
Okay, is there a motion?
I'll move favorable.
All right, we've got a motion and a second, and a discussion on the motion. All right, all in favor, please raise your hand. All right, that's unanimous. Okay. Okay.
Okay, the last bill on your list is Senate Bill 917. This bill comes to you through Senator Augustine via the Health Services Cost Review Commission. The bill would authorize the commission to, through a different mechanism, increase the user fees they charge so they can conduct their business. If you go to page 2 of the reprint, you'll see in a language that really only the commission can understand. This allows them to charge a higher fee against hospitals, and I think it's primarily hospitals who would pay the cost, who pays the cost of the commission's regulation. The House didn't make any changes to this language here, but they went a little further and did some algebra on their own. And if you go, you'll see that they've added more language in the back of the bill. And what they're doing is they're leaving this language intact and the bill is introduced. But then in 3 years, they terminate that method of assessment. And then going forward after that, it'll be the average of the amounts determined under those 3 years under this new formula for assessing user charges. So after 2020, whatever, this will become the way the commission will determine its user fee assessments going forward. And the House bill, as I can see from our status, is already in the Finance Committee, looking like this.
Okay. Senator Reedy?
Maybe the sponsor would like to speak first.
Basically, the information on the back allows for the legislature to come back and take a look at this, that we must come back and take a look at this. The way that this is right now, actually the budget for HSCRC actually exceeds this amount. And so what this is trying to do is just trying to give them the opportunity to, basically recoup the money, but it's up to. It's not, it's not saying that they must raise it, but it just is more aligned with the actual folks who they are responsible for. And that's the reason why they asked for this change, so that it would, so they would be able to keep up with this. So I think that it makes sense, particularly given the guardrail that they put on it at the back. The legislature will have to come back and assess this. That's what that back guardrail is for.
Okay, Senator.
So she moved it, I was seconding it.
Okay.
So
Senator Reedy and then Senator Hershey.
can I ask, and it is good we're coming back, that is a good thing that we come back for it, but what does that mean then? So it was 16 million. What does this new formula take it to in 2023?
That would be in the fiscal note.
Does that compensate the amendments?
I'd have to, I don't know if they did the third reader version of the amendments, but
I know it was 20 million in the original bill.
yeah. Well, if for over those three period, if whatever that average is, that would be probably what they're gonna be doing, you know, until you come back and revisit it for that, beginning in, you know, when this method sunsets, then they still have to have a way of doing it every year. So section 1 of this act will take effect July, it will remain effective for a period of 3 years and at the end of 2025. Section 1 will no longer be in effect. Section 2 of this act shall take effect on the termination of the provisions of Section 3 of this act. If that takes effect, okay, so I would imagine it'll be something similar to what they've done over that 3-year period. So it's
So-
going to be that average.
So 0.1, so going back to page 2 of the reprint, 0.1% of the immediately preceding fiscal year's budgeted regulated gross hospital revenue or the largest amount determined under this paragraph for fiscal year during the immediate 5 fiscal, is that about $20 million? I'm just asking what the amount is for the first year, because if we're taking the average, I just want to know what we're voting on.
It would increase by about, if it's 16 million now, it would increase by about 20, it'd be about $20 million based on what.
They're just saying it differently in the bill.
Yes, yes.
Okay.
Okay, we're going to Senator Hirsch and then back to the sponsor.
Thank you, Madam Chair. Neither David or the sponsor could answer, but Hospital Association's testimony said this would give the HSCRC unique authority as a state agency to raise fees automatically. Is that still in play here? Okay.
Okay, Senator,
That is the case, and what I would share, though, with you is that I was asked by the Hospital Association if this was going to be the posture that was assumed by HGO, that if we were going to assume this, that's what they were comfortable with. I'm just sharing that with you.
The way that it is.
Correct. They shared with me that if it has that on the backside, it's the posture of the HGO, then they said that they were okay with it. That's what they said to me.
Okay. Thank you.
okay. Any other questions? Senator Hayes?
Did the HSRC, it wasn't clear in the hearing if they asked for this, right? So they came and asked for this
Yes.
for what purposes?
So that they were, it's so that they have the mechanism to be able to
Right, to
recoup,
increase it.
right?
Right.
Exactly, such that, so basically what's been occurring is that they have had a reserve that they've had to kind of like figure out how to go to different places in order to cover their entire budget. And so we end up paying for it one way or the other. What they're trying to do is basically put it into the place, which is the hospitals, into those rates and everything where it really belongs, instead of having to try to come back to the legislature for supplemental money and do these different things. They're trying to basically get it into the right place for the work that they have to do.
Right.
And that's what this mechanism is for. Previously, they had that cap, right? But they've always had to come, their last year's budget was, I think they told me like 18.2 million, for example. And
Right.
so it's not that they will exceed it, but they're just saying, let's just put it into the right place, which is what this will do, and it'll allow them to do that.
Right, but typically when they come to us, like when they wanted to raise the rates for like the violence prevention programs and stuff like that, they typically come to us and tell us like, these are the things why we want to raise the rates. Is that still built into the system?
I'm not sure what you mean.
They're not, I mean, they simply set hospital rates.
Right.
Violence prevention programs, right, yeah, so whatever it is, the current cap on their assessments,
Right,
as
so
Senator
the
will not cover their.
hospitals, so LifeBridge and a couple other hospitals got together. They wanted to provide programs to violence prevention programs like, what's the name of that organization? Safe Streets, right? And I think Blue Cross and Blue Shield was opposed to it because they was like, well, they just raised rates before. Why would we allow them to assess even more in the hospitals or whatever just for this purpose?
This is separate. I mean, this is for the commission to operate, not for anything the hospitals plan on doing with rates. So that, you know, it's a sort of like the commission gets its money to operate. It's a special fund entity, like the other commission too. They're all special fund entities, and their operations are completely funded by the industries they regulate. So in this instance, the commission's budget exceeds their cap on what fees they can raise, so they're asking for the ability to cover their costs, which is what you want a special fund entity to do, especially a regulator. Yeah, otherwise they'll have to borrow general funds to regulate the industry.
That's what we're trying to avoid.
And so whatever hospitals are doing separately, and if they're trying to, get rates for that particular process, that's something the commission makes a determination on, whether they approve that or not. But that has nothing to do with their ability to get funds to operate as a regulatory agency.
Right, and so when they have to go to the general fund because they don't have enough funds, because they have the ability to assess these fees, do the general fund recoup whatever it is that they put up, or is just a loss?
I don't know if they've actually had to they have a balance, so I'm not sure if they've actually had to get general funds. That would have showed up in the budget. I think they're still largely making do with with their special funds.
Okay. Senator Augustine?
No, I was done.
Oh, but you had your light on, I thought. Okay, all right. Okay, any motion, or did we have one already? No, we haven't voted. All right, so who made the motion? All right, Senator Klossmeyer, who seconded? Okay, any discussion on the motion? All right, all in favor, please raise your hand. So I'll just go along with it, I don't know. All right, well, it's not unanimous, so let's just call the roll.
Senate Bill 917, favorable with amendments. Senator Feldman? Aye. Senator Klausmeyer? Yes. Senator Benson? Yes. Yes. Senator Kramer?
Yes.
Yes. Senator Hayes? Senator Reedy? No. No. Senator Augustine?
Yes.
Yes. Senator Beidle? Yes. Yes. Senator Hershey? No. Senator Jennings? No. No. Senator Hayes?
I really don't understand this bill. I don't. I didn't understand it during the hearing. We couldn't ask questions.
So your vote is?
I abstain.
All right,
Abstain. Madam Chair?
yes,
Yes.
okay,
Bill passes.
okay. All right.
That's it. That ends our
All
voting
right,
session.
this ends our voting session, guys.